All right, so an overview of today's agenda. As I mentioned, Karen is going to be talking to us about some issues related to the child welfare system in North Carolina. Then we're going to have a special Voices for Children invitation. Next Friday, April 16th, is our Voices for Children virtual awards, and we're very excited about that. And then we will be getting a legislative update from our lobbyist, Ashley Perkinson, and our policy director, Tiffany Gladney. And as always, at the end, we want to allow for some time for any announcements. So without any further ado, everyone, speaking of Voices for Children, one of our former award winners, Tom V Award winners, Karen McLeod. Karen is the CEO and president of Benchmarks North Carolina, which is an alliance of agencies helping children, adults, and families here in North Carolina. And Karen is a wealth of information around issues related to children and families. She's a wonderful advocate and someone who is going to the legislature in person, virtually, however it needs to happen, and advocating for kids day in and day out. And she's going to just provide us an overview related to some things going on with our child welfare system here in North Carolina. So I know I'm interested in hearing this, and Karen, we'll turn it over to you.
Thank you so much, Adam. And I will try to talk slowly, but it is not one of my strengths. So if I start chattering too quickly, y'all all can just wave your hands at me and I will try to slow down. You would think as a Southerner, I talk slow, but it just was not my genetic makeup. I want to talk to you about a couple big things that are going on that have had huge impacts on the child welfare system. One of which is we are getting ready to head into Medicaid Transformation, and we're going to be starting standard plans in January. And I think a lot of people feel like standard plans really isn't going to impact children on the mental health side because, well, clearly those children will be with LME MCOs, the system we currently have, but that's not the case. Just to give you a little sense, about 50% of all the children who show up in emergency room hospitals for a significant behavioral event have never presented behavioral health issues in the LME MCO world before. So all of those kids, when you think about 50% of the children who show up to these hospitals, emergency rooms, will be in standard plans come July. And when you think about, how do you manage children who come into these hospitals, a lot of those children are sitting in hospitals for 60, 90. We even have a case currently where the child has been in placement for 180 days in a hospital ER, which is paramount to child abuse. It's horrible. We've got to find ways to move those children. But one of our fears is that that's happening in an environment where we have LME MCOs that have been doing behavioral health and have a very large array of community-based services that they can utilize, as well as inpatient behavioral health called PRTF, and outpatient if the child is able to do some sort of community-based. Our concern is come July, we're going to have a whole new set of entities, these PHPs, prepaid health plans, that will be managing the behavioral health for at least half, if not more, of these children. They don't have an array of behavioral health services. They basically are outpatient, which is what they have signed up with providers of behavioral health in a contract, and then they have inpatient. And so this gap that we're getting ready to head to is causing us a great deal of alarm. Now, let me just add a little more to that. In October, there's a federal reg it's actually a bill that passed, it's statute now, that is going through called the Family First Act. The Family First Act has a brilliant concept where it's really trying to move our interventions for children who are involved in the foster care system early on to put supports in place around the family prior to the child being disrupted from the family, which we all are like, yeah, why haven't we been doing that? Brilliant idea. Exactly. The problem is that our system hasn't been built to support, the infrastructure isn't built to support that kind of integration where children who come to the attention of DSS are then connected with the behavioral health supports that the family needs. And the thing to remember is we historically in our child welfare system have treated the child and not the family. We need to remember that children don't come into the behavioral health system. They don't come into child welfare unless there's an issue with their parents. That is the only reason they come into child welfare, is that the parents are in some way, there's abuse and neglect and they can't manage that child. So if you treat the child separately and you're not treating the family, you are never addressing the issue. And so we have to completely change the way we do that. And that's what Family First is supposed to be doing. Now, remember what I just told you about come July, when we have standard plans, and about half of them within that hospital that come in, the kids that come into the hospital will fall under standard plans. And they just don't have a behavioral health network, support systems. They don't have a family focus. It's very specific to the patient. They have a patient mentality. Well, come October, when Family First Act goes into play, our state is required that when children come to the attention of DSS, that they will be mandated by, they have a definition that they use. And if the family falls into that definition of at risk of coming into care, then these support services are to be offered to the family to hopefully stabilize the family so that the children are not removed. But in looking at this, when we look at families who come into in-home services with social services, meaning that they're being supported before the children are removed. They're trying to keep them from removing children. When they are coming into DSS in that space, the largest percentage of them are going to be in standard plan, partly because most of the families that come to that attention, they have smaller children. And children under 5 don't even fall under the LME MCO purview. And so when you look at the kids that are coming into play into this Family First Act, the bulk of those are going to be addressed by standard plans. The standard plans have not even been involved in the discussions of Family First Act. And my guess would be is if you called any of them up and asked them what they were going to do, they would say to you, what is Family First Act? And it's just because everything is happening so fast with COVID. The department is completely overwhelmed, right? They're trying to keep the pieces running, keep stuff moving, manage COVID, do a massive vaccination. All this happening at the same time has really stressed the capacity and resources of the department. And the managed care companies, the PHPs, prepaid health plans, these guys are also completely overwhelmed. They're just trying to get ready to lift these new health plans across North Carolina. So even their capacity to have discussions about this is really limited. All this is to say is we have all these changes happening with the state system, and we are not prepared, particularly for our younger children, to support their behavioral health needs under the standard plan. And that has caused us a lot of concern and a lot of discussion. The other thing I would note big in the system is that when COVID hit, we saw a lot less ability to move children, say, for instance, out of a psychiatric residential treatment facility. We have these residential behavioral health facilities that we place children in when they're not deemed to be able to be placed with a family, a foster family, therapeutic foster family. And so we stopped seeing movement out of those. And there was lots of reasons I don't have time to go into, but the bottom line is this. We've been able to get less children out of PRTFs, which means there's more children sitting in hospitals waiting to try to get into PRTFs. And there also has been less places for children to step down because because the court system slowed down, we haven't been able to step kids down to therapeutic or even necessarily foster care because the courts have slowed down and their cases are not getting moved. So we're not getting finalized movement in those kids' cases. And so they're not moving. So everything kind of crunched up into a standstill. The hospitals are very upset, and rightfully so, absolutely rightfully so. They're holding children who do not have physical health needs, but have very significant behavioral health needs, and they have nowhere to put them. The result has been this huge pressure, the most I have ever seen in my entire career, and I've been around a long time, to build
Okay, can you guys hear me? Of course, my phone call dropped while I was having this presentation, because that's the beauty of doing online anything. Did y'all see how fast I recovered though? It's because this happens to me, it seems, all the time. And so we're seeing this huge pressure to create these residential facilities. They want to build lots of PRTFs. And I have never seen the pressure I have seen before to try to get these kids into residential facilities. Let me just tell you, this is sending alarm bells off for us like fire. The last thing we want to do is be building residential treatment facilities to be putting kids into. We should be investing in community-based services. And I will tell you, I've been a clinician a long time. I don't do direct clinical work, but I'm pretty good at understanding, looking at a clinical profile. We have kids that are served in therapeutic foster care that if you looked at their clinical profile, it looks like a PRTF, a child in PRTF. We can serve so many more people in the community, but we have to build the right infrastructure to do that. And that means thinking about things differently. For instance, doing wrap services, support services with the family, giving the family respite, letting them have a break, giving foster families and TFCs real extended breaks. They need to have respite as well so they can manage higher end children. Doing wrap services in foster care, which we don't normally do. We normally put wrap mental health services in therapeutic foster care, but why are we letting children fail up before they access care? This care should be available wherever the child is and whenever the child needs it. So if they are in the foster home, and we should be doing wrap services to support that family to prevent disruption, that's where it should be. So, if they go to kinship care, we should be supporting, you know, the auntie or grandma or whoever has taken that, the child or children into their homes. So what we're sort of alarmed about is some of the changes that are coming with the standard plans coming on board and just not having this network of behavioral health in place. And the other that we have concern about is this real pressure currently to have all of these residential facilities for kids. Institutionalizing kids is just terrible. The evidence is so clear that when we place them in these institutional settings, that their outcomes, they just decrease. I mean, flat out. Same as we know that if they're placed with families, that they do better than if they are removed from their families and placed in foster care. So there's so many things we know, but we don't do good work to support that, partly because of how the payment system is currently set up. Now, the good news is I think there's going to be some great changes with DSS. And part of this came from a bill called Ryland's Law. Ryland's Law was an omnibus bill. I think it was 26 pages. It was kind of a beast. But one of the things that it looked at was really, how do we improve our child welfare system? And one of the things it looked at is we need more oversight for the counties and training and support. And the counties will tell you, we need training and support. When you have 100 county DSSs, it's difficult to manage all that from one central location. So what Ryland's Law did is it provided to create a regional oversight, and it put a work group together that decided that it would be 7 regions. And there's legislation this session that actually funds and supports putting these 7 regions in place, which we're particularly excited about. One of them is Senate Bill 90, and this is called the Social Services Reform, and it came out of this social services work group from Ryland's Law. And what it does is a number of things, and this was all recommendations that came out of the committee, as well as another committee that was formed in Ryland's Law, which was called the Child Wellbeing Transformation Council, which is a really long name, but basically it's a children's council. And out of this Children's Council and from that social services work group, this bill, Senate Bill 90, that is supported by Senator Krovic, Bergen, and Perry, there are a series of recommendations, and one is that 7 region oversight, but it also talks about how important it is to begin permanency planning no later than 90 days after the child's 17th birthday. And that is about children who transition out of care. Many of these children end up homeless, having unintended pregnancies, utilizing substances, because they are not prepared to be living on their own. And so there's a real emphasis in this bill to prepare and support them. It also talks about the importance of keeping foster children in community-based services. This is something we talked about a lot in the committee, that we need to be, again, investing in community-based, not in residential. Now, I will tell you, I believe that the continuum is important, and we do have a need for some of those high-end services for children, but we should not be using them the way we're using them. They are overutilized. This should only be the exception to the rule and not the norm. And I will tell you that I think in a lot of ways it's become the norm, and we have to change that. That's our responsibility. The other thing that it does is it really tries to enhance the guardianship assistance program, which is great for our children. Another bill that was partly driven by this, but also the court improvement program, is, sorry, I'm gonna pull this bill out. It's actually Representative Stevens, and this is House Bill 132. And the beauty of this bill is it really focuses on things, really cool stuff, like keeping siblings together. And when you remove a child from their home, their siblings are the only family they have left. And keeping them together is very, very important. And our research shows that if you separate these children from their siblings, the likelihood of them being reunited is quite low. And so it's really important that if you do have to separate them, because it's clinically appropriate, that you are very cognizant about making sure that there's continued communication and relationship building between them, whether it's visits, video, or whatever. The other thing that it does is it spends a lot of time in this bill talking about all the supports that need to be in place for children who are aging out of care. And this is one of the best bills I have ever seen to support children aging out of care. One of the big issues that we see is that when kids are leaving, they don't have important documents like their Medicaid card or an ID, or their educational history and documents related to that. And all of this requires that this information be done. It mandates that the county DSS do it as well as the court. So one way or the other, these supports have to be in place for these children before they turn 18. And honestly, again, this is between these two bills, I think there's some significantly good changes that are going to be coming. And I know Ashley's going to do a legislative update, so I don't want to spend too much time on that. But I do want to give a plug for another child welfare omnibus bill that just came out last week that I'm super excited about. It's Senate Bill 518, and Senator Batch, Bergen, and Edwards are sponsoring this bill. And this bill, one of my favorite things in this entire bill, is it's trying to move children to permanency more quickly. And finally, in this bill, it actually requires that you have to have a permanency planning hearing within 90 days of the initial dispositional hearing. Now, that doesn't sound like a very exciting thing for most people when they hear me say it, because it sounds very legal, and I would agree with that. But what this means is that within 3 months of their dispositional hearing of children coming into care, there's got to be a plan. There's got to be a plan. And what we have seen is for many of our children, it's a long time. It could be up to a year before they have a plan. Completely unacceptable. Our children just languishing in foster care is unacceptable. We need a plan. They need a plan. They need to know what's going to happen and what their future is looking like and what's the intended outcome for them. Leaving them in this limbo is just crazy. I'm going to leave on two other positives because I like to leave on the positive since I started out with some scary. Another bill is Senate Bill 93, and this is a bill that would allow us to be able to support parents after their children come into foster care. And that is if they have Medicaid prior to their children being removed from them and taken into care. Currently, once those children are removed, they lose their Medicaid eligibility. What this would do is it does not take their Medicaid eligibility from them. It allows them to continue to have it, which is so important because they need to be able to access the treatment that's required to get reunited with their children. And I just want to say that that is something that we have been trying to get for about 5 years. So we are super excited about this bill. We're also, again, in the last last budget that was passed a few years ago. We haven't had a budget in a while, but the last one that was passed included an increased rate for reimbursement of foster families. And we are working very hard to get that back in the budget again. There's not a bill. We're doing this all behind the scenes with the budget. So this is not something you'll see at the, on a bill, but I want you to know that this is a priority for us and that we are really stressing that this get included. Foster families have really, really been put through the ringer during COVID. When you think about it, they weren't expected, for instance, to be making breakfast, lunch, and dinner. They were not expecting to be monitoring children all day. Children were going to school, they were going to daycare, and then they weren't. And so suddenly they were managing all of this all day long, taking on way more than many of them had anticipated. And for those of you who don't know, to be a foster parent, one of the requirements is that you're employed. And so trying to work while managing all this has been really, really challenging for them. And we are definitely wanting to see them see a rate increase, which, by the way, has not happened in over 12 years. So I'm thinking it might be about time. Okay, I'm going to stop there because I think I might have been pushing time, and I will take questions, and I talk too fast. I'm sorry.
That was wonderful, Karen. Lots of great information, and appreciate you ending on some positive notes, some things that people can support and hopefully help get over the finish line this legislative session. Sounds like you said, that Senate Bill 93, Senate Bill, I think there was a Senate Bill 518, House Bill 132, maybe that was a Stevens bill. All of these we can share back out with folks too, but that's a good way that maybe people can specifically tell their legislators, like, hey, I really hope you support this for kids.
Yes, and we hope that all of you are involved in talking with your legislators and really stressing the importance of putting priority on children. I just would note one other thing. We've been working with a senator, Senator Bergen, who we've been working with him through the Child Fatality Task Force. This is a little bit different, but I just have to throw it out because I'm so excited about it. He just put a bill out last week that would extend the coverage of Medicaid for pregnant women from 90 days after they have a child to a year, which is amazing. Now, I would just note, it'd be even more amazing if we expanded Medicaid, because then we wouldn't have to pay for that. But I'm excited to get the coverage. So I'm just noting that too.
Yeah, absolutely, Karen. I know we're trying to help on that one too. So Fawn, do we have any questions in the chat or anything that's come up?
I have one question. Karen, what was the first bill number you mentioned about the Transformation Council?
Yes, that's Senate Bill 90, and that is Kravick, Bergen, and Perry. And Kravick has another bill that's out, and that actually funds the regional oversight. This bill just is the mechanics of the things that came out of the Social Services Work Group and the Child Wellbeing Transformation Council.
Cool. Thank you for saying that full name all together for me.
Yes, it's a lot, isn't it?
Yeah. So you started with a little bit of kind of bummer news regarding Medicaid transformation. And do you have any more information about how I know we have a lot of foster parents and other folks engaged in that system, probably on the call today, but who get these updates. So can folks engage in that process and try to improve those outcomes at this point?
So the part I would tell you is, we're having this conversation about the challenge. This conversation is not happening in the department. So we're trying to get the conversation to happen in the department. So I think until we get them to sort of hear it and engage in it, I'm not sure how much can be done. I can tell you that there's a foster care plan carve out. And that's a fancy way of saying that when we go to tailored plans, they plan on, instead of our children in foster care going into the tailored plans, they want just a special plan separate just for their children who are in the foster care system. And they want one statewide entity to manage it for the whole state. They had intended on bringing that foster care plan up at the same time that they were implementing tailored plans, but they had started really late in the game and trying to get it ready. And we had been kind of, for those of you who know me, I have a skill of hounding people. So I had been hounding of, we've got to have a good plan. This is an opportunity to do some amazing changes, schema shifts, if you will, moving from treating children to treating whole families, moving away of waiting till children are in crisis to when children are identified and their families are identified at risk, that we go in and we do these services early. It was really just this opportunity for a true transformation of our foster care system. Unfortunately, because they were so late sort of getting to it, because they were completely overwhelmed with everything else and COVID, the plan was not great. And so there were a lot of us, NC Child included, who wrote letters saying, you know, that's just not good enough. And so graciously, the department heard that and stepped back and said, we need to rethink this. We've got to do something different. And so they're putting a work group together. And so the hope is from that work group, some of these discussions, like stuff we're freaking out over that I just told you about, we have a space to have that with all the right people. And I think when we get to that place, there's an opportunity to bring other voices in. And I will tell you, there's a foster parent association, a statewide one. Gail, oh, I'm blanking on her last name and I feel so bad about this right now. Friday, COVID, I don't know, something, my brain's not working.
Osborne.
Yes, Osborne, thank you. Oh my goodness, she would just die if she knew I forgot her last name. Anyway, so Gail and I have been working on a foster parent bill of rights that's going to be introduced next week. Representative Willis is going to be introducing that bill. We worked with the Department of DSS as well as the state DSS. So we brought everybody to the table. We vetted it with their attorneys, which is loads of fun. And I think we've got a good product that gives us, I think, some space to also have some conversations about the impact all of this is going to have on our foster families. But it also, I just want those of you who are serving as foster families on this call to really think about participating in this statewide group, because we're helping them and they are doing, I think, a pretty daggone good job of creating a space for your voice. And we just really want strong, skillful people to be adding to that cacophony of voices that they're creating, because that's really going to, I think, open the door to some different conversations that have not been had as yet. One of the things we talked about with this foster care bill of rights is that there is a lot of foster families do not feel respected. They do not feel their voices heard. They feel like they're just kind of a leftover in the process, and it should never feel that way. Serving as this, you are a professional as part of the team, and you should be treated and supported as such. And some of this is cultural change, some of it's training. One of the things that I insisted be in this bill, in the foster care bill of rights, is that they're trained on what their rights are in court. We've been told many of them have gone to court and nobody knows these kids better than they do. They're in the home every day and they're not allowed to speak at court. I mean, there's things like that we need to change. And I think, I've heard a huge amount of ruckus about we've got to get more foster families recruited. And my response back is until we really start treating our families right, it's going to be hard. And we've got to change how we approach them, treat them, and recognize them as critical partners in this team that's created around the children when they come into care. I'm sorry, that was way more than you wanted. Sorry.
That's good. Amen. Fawn, was there anything else that had popped up?
I think everything else I see in the comments are things we're going to be covering during the legislative update. So I think a lot of amens and gratitude to Karen. So thank you so much.
Thank you, guys.
Thank you, Karen. We appreciate you.
I appreciate y'all letting me come today. Call me, ask me to come again. I want to hang out with y'all because you're just fabulous. Happy to come back anytime. So thank you. And I hope you all have a wonderful weekend.
All right, you too.
Bye, guys.
Bye. All right, everyone. I know I've learned a lot there, and every time I hear Karen talk, I can get a little overwhelmed. But it does sound like that there are some solid, positive things, some legislation that we can all hang on to and advocate for, and help make things a little better. So now we'd like to turn our discussion over to Tiffany Gladney, our policy director here at NC Child, and provide us a weekly policy update from her perspective. I'm not sure if Ashley's joining us today as well, but I'm going to go ahead and turn it on over to Tiffany.
Yeah, thanks, Adam. So with the legislature being on spring break, I said, you know what, Ashley, you can give your Kitten Hills a rest this week as well. So it is just me today holding down the fort. I wanted to give Ashley a little break this week. So as I just mentioned, the legislature is on spring break, but they also had a bill filing deadline in the Senate of April 6th this week, and we saw a slew of bills coming out. So although there wasn't a lot of movement because obviously they're not in committee this week or voting on anything, they definitely didn't fail us when it came to filing the bills. So we've broken them down into categories. So the first one on the health side, we were absolutely thrilled to see the filing of bipartisan legislation. Karen actually just mentioned this, seeking to extend postpartum benefits for Medicaid beneficiaries from what it currently is, which is 6 weeks to 12 months. So this is Senate Bill 530. Medicaid for 12 months postpartum. And this bill has been assigned to the House Rules and Operations Committee. We also saw some really cool legislation filed, House Bill 507, the North Carolina Momnibus Act, which Karen also mentioned. And this is a really lengthy bill, but it covers multiple issues, including maternal mortality, breastfeeding support, and additional postpartum supports. It also covers things such as implicit biases when it comes to how women of color are treated when they go into their doctor's visits. Then a bill that we've been covering for a few weeks now, Senate Bill 146, the Teledentistry RDH Admin Local Anesthetic Bill. It passed the Senate last week and is now in the House and has been assigned to the House Rules, Calendar, and Operations Committee. And the goal of this bill is to allow dental hygienists to practice teledentistry, administer anesthetics, among other teledentistry procedures. So on the early childhood front, we saw the Smart Start Funds, Senate Bill 464, get reassigned this week. It initially was in the Senate Rules Committee, but it has now been re-referred to the Senate Appropriations Base Budget Committee. So we'll keep you posted on how that fares in that committee. And this is the legislation that seeks to have a $30 million investment, recurring funding, by the way, into the statewide Smart Start program. Then there's House Bill 570, the Hold Harmless Star Ratings ERS Assess. This bill is filed this week, and it proposes to hold childcare facilities harmless on environmental ratings should staffing shortages affect their star ratings based on the pandemic or other extenuating circumstances. So we'll see how that one fares as well. On the child welfare side, there was Senate Bill 535, the Safe Surrender Infants Bill. This one seeks to tweak the statutory changes for infant surrender due to abuse, neglect, or dependency laws. And then we also saw some additional bills targeting transgender children this week. North Carolina legislators have garnered some national attention with a pair of bills targeting transgender children. Of course, there's Senate Bill 514, the Youth Health Protection Act, which would ban people under the age of 21 from transition health care. It would also require state employees, including teachers, to put in writing and report in writing when they see a child not conforming to gender norms. And then, of course, there's House Bill 358, the Save Women's Sports Act, which would restrict transgender youth from participating in school sports teams. And just to be clear, NC Child believes that every child should be supported and affirmed for who they are. And we strongly oppose any legislation that creates discriminatory policies against children and youth. And we actually put out a statement that delves into why we stand where we stand on these issues. So visit our website, and I'm sure Fawn will put the link in the chat as well if you want to read our full statement on the well-being of children and affirming children for who they are. So on the federal side, of course, President Biden has rolled out part 1 of his infrastructure plan, and we are still waiting on the reveal of his American Jobs Plan part 2, which is supposed to tackle human capital, which includes healthcare, childcare, paid leave, things of that nature. That'll really hit home for us here at NC Child and for all of you who are on the phone right now and on Zoom. So that was a lot. So with that being said, the legislators return Monday. We have some things in the work that hopefully we can talk about next week. So stay tuned. And I will actually be stomping the halls of the GA next week with Ashley. So I'm dusting off my kitten heels as well. So stay tuned for some exciting details, hopefully, y'all.
Thank you, Tiffany. It's your triumphant return. There's going to be like music and confetti and
might be some booze.
Stay safe. Stay safe. Okay, so do we have any questions or comments related to Tiffany's update?
Let's see, I'm looking through the chat. I see a question from Ms. Peltzer about House Bill 186. Do we know anything else about what's holding up that particular bill?
We don't, and unfortunately, Sheila, it still hasn't seen any movement. We just got a new legislative tracking software, and you better believe I was thinking about you, and I tracked that bill. So I'm keeping a close eye on it, and I have alerts going. So I got you.
Hey, Tiffany, can you give folks an idea just of timeline as kind of as we governor's budget, but on the ARP money, like kind of what that might be looking like in the weeks ahead?
Yeah, so we are in the throes of budget season. Of course, Governor Cooper released his budget a few weeks ago at this point. What is today? What is time? So at this point, we are waiting for the House and Senate to also release their budgets. And I have some really cool ideas on how we can show you guys the comparison amongst the two or three. So stay tuned for that. And then we are working with some coalition partners on some proposals on how a lot of that federal funding that's going to be coming down can be spent. So stay tuned for a lot of details on that. We're going to be really hitting the ground running and making sure that legislators know exactly where we stand and what we think the priority areas are for investing.
There is a question in the chat about teledentistry, and I want to call on Kaylin to see if she wants to take that one.
Absolutely, because I am so excited about this. So teledentistry quite literally allows a dentist to remote in, so they don't have to be in the room while the service is being prepared by the dental assistant or hygienist. And so they are able to communicate with the dentist about what is happening with the patient, what the correct course of action could be if there's something beyond like standard cleaning and just checking in. So what is really exciting about this is that it really opens up access in really meaningful ways, particularly to our rural communities that are just in deserts when it comes to accessible care, particularly for dentists who take Medicaid. That is a dwindling population. And so this is a really important first step to bridging that gap. And so it can look like consultation, it can look like bringing a camera and having the dentist take a look at what is happening in the mouth. And it's a way, again, of having these kind of satellite dentists come in and be in the room without having to be in the room. So it really does extend access to care in some really major ways. And there have been reports, and I can see if I can find them real fast and put them in the chat to talk about why this is really helpful for communities that are often left behind in oral health, particularly Black and Brown communities. And as I mentioned, rural communities as well. So super exciting, good first step. We've got a ways to go on oral health, but I will take whatever wins we can get.
Absolutely. And before, and so I want to now shift gears again real quick if we can, and I've gone out of order here a little bit, so my bad. But we want to talk about our Voices for Children event next Friday. We want everyone to join us for that, be able to listen in and see these really awesome award recipients. And Michelle, I wonder if you want to say just a few more words about that.
Sure. First of all, you all may be asking and wondering to yourself, is Kaylin always so energetic and enthusiastic and excited about Medicaid? And yes, she is in every meeting. And I love it. And so thank you, Kaylin, for that really good update on teledentistry. That's awesome. So yes, I don't know about you all, but we have been having a hard year for our kids, for our families, our staff. I know that we are tired. It has been a long 2020 with the pandemic. And we have been working really hard, as so many of you have as well. And so I am so excited on Friday of next week that we can take a moment to step back and really recognize the great work that so many advocates on the ground have been doing. Because if we don't take a moment to celebrate and find hope and some joy, we're all just going to burn out. So I really love the fact that we are going to spend an hour together as a community of advocates, recognizing 3 different advocates and advocacy groups. One, Cassandra Brooks, who, as many of you know, is a fearless and tireless advocate for so many things around young children, Medicaid expansion, early education. We also have 2 Community Voices Awards. So these are recognizing grassroots groups doing amazing group. One is Peach of Durham, and the other is Soaring as Eagles from New Hanover, from Wilmington. These folks are on the ground every day, like so many of you, working with kids and families and speaking out about the needs of kids and families in their communities. And we are really excited to be able to recognize them and honor them and do a little celebration in the midst of what, again, has been like a really hard time for so many of us and our kids and families and communities. So it is 1 hour long. So we are short. I just watched the video that we're going to have of Cassandra, and y'all, I cried my way through it. It's so good and so inspiring. And so please join us on Friday. The registration information is in the chat box. We have over 200 folks already registered, and they're flowing in today. It is a great way to start off your Friday with a good, strong dose of some inspiration and some happiness, actually. So please join us. And if you have questions, you feel free to email me or Eliana, but we hope to see you there on Friday, 9 a.m.
Thank you, Michelle. Looking forward to that. And I'll challenge everyone, join us and try to get one other person to join us as well. Maybe somebody that's never heard of NC Child. See if you can get them to tune in as well. So do we have any other announcements prior to adjourning today? Okay, if not, here is our preview of some things to come. Of course, next Friday will be our Voices for Children. So we'll have no meeting at 11. We'll have that event instead at 9 a.m. next Friday. The following Friday, we're going to be joined by Matt Gross, who's the legislative liaison for DHHS, who's going to talk to us about some of their legislative priorities and where they stand right now. And then something I'm really looking forward to on Friday, April 30th, we're going to have the North Carolina Low-Income Housing Coalition speaking to us regarding issues of affordable housing in North Carolina. And there's really just so many things to talk about there, but this is something that I know all of you all also have a keen interest in and are involved in a lot of different ways. So I think that'll be really informative to give us all perhaps some actions we can take to help be supportive on that front as well. Okay. Of course, look for the recording later on via email and share that with others if you'd like. And as always, feel free to be in touch with any of us if you have any questions or concerns. And we hope you all have a great weekend, and we will see you next Friday at the Voices for Children event. Thank you.